So let's begin with Alan Skinno's study streak, and it's day 26. And we have three remedies to discuss today. One is Colophyllum, another is Semicifuga, and the third is Lilium tigrinum. So, if we recollect from what we read yesterday from MacFoss, we very well know that it's an antispasmodic remedy. And when we think of spasmodic remedy, one of the remedies that strike our mind is Macphos, Colocynth, Berberis, Dioscorea, etc. etc. But if it is a female complaint, we would mostly think of Colophyllum also, apart from Macphos. So let's go and see what is written in Colophyllum. Pains are intermittent, paroxysmal, spasmodic, rheumatism of women, especially of the small joints, and this is very similar to Thalaspi bursa pastoris. So all the female remedies who have spasms or uterine affections are mostly somewhere or the other also working on the joints. And if you see the connection, you see that there is uterine affections with the joint pains, or if uterine correct diseases are there, there are joint pains later on that they come up, or it has happened before. So one of the top remedies for uterine fibroids or uterine complaints with small joint problems, we should think of Colophyllum. The other remedy mentioned in the bracket is Actias piccata. All right. So then we have something in which is what we saw in pulsatilla also, which is erratic pains. And if there are rheumatism of the small joints, erratic pains, which also would mean that there would be pains in one part of the body and then in the other part, we should think of Colophyllum if it is a case of female. Many times in our clinics, we think of rheumatic remedies. Colophyllum is one of the rheumatic remedies because uh, if you see the symptomatology, it points towards rheumatic and uterine affections. There is painful stiffness of the affected joints and pains which keep on changing place from one joint to another joint. So it is like the wandering pains and rheumatic affections. Especially suited to women, ailments during pregnancy, parturition, lactation, chorea, hysteria, or epilepsy at puberty during establishment of menstrual function. So during the time when there is uh, menarche which is setting in, and some complaints happen during that period, whether it is nervous system related or joint related, or uh, something that disturbs the psychology of psyche of the lady, we should think of Colophyllum. The other remedy is also Semicifuga. Leucorrhea, acrid, exhausting, upper eyelids heavy. Now, interesting thing is that you see the mention of a female system, female reproductive system. You see the symptoms mentioned for leucorrhea, which is acrid, exhausting, and immediately next you see upper eyelids heavy, has to raise them with fingers. So you have to understand why it is placed over here. The one of the main reason is that this is a connecting symptom. So, in cases of leukorrhea, if you see a lady with eye complaints or heaviness in the eyes or something on the face, further which is written with moth spots on the forehead, which is also seen in sepia, or in little girls like calcarea carp, and if it also is a symptom complex where the lady has got married and is unable to conceive, then Colophyllum needs to be thought. So there is a mention preventing pregnancy. So many such cases that you see in your clinic, you focus on one symptom at a time. But if you connect two, three symptoms together, you will be able to understand that these components will bring to a remedy. It is not always that you should go in the repertory and look for a symptom. At times you can just you know look at one rubric if you want to, or else at times you should take the path of understanding the different components of the case. For example, uterine affections, joint pains, think of colophyllum, think of Thlaspi bursa pasteuris, think of calcarea fos, which is also a rheumatic remedy having uterine affections, and I have given it to few patients over here. So in this way you can make your own components and try to correlate from the materia medica and find out what suits best to the patient. Then we have habitual abortion from uterine debility. The same is mentioned in elateris ferinosa, and if it is from anemia with profound melancholy, the remedy is helonias. Now uterine debility means that there is no changes or movement in the uterus after some time of conception, which the normal process should happen further for development of the fetus, and that causes an abortion. In those cases we can think of polyphyllum. Spasmodic rigidity of os delays labor, needle like pricking pains in the cervix. Now whatever symptoms we will see from here on are mostly related to females in the process of labor or who are in the process of delivery, and this is best adapted to an IPD case. So getting someone in the clinic with these symptoms is difficult, but if you have a setup, if you can approach a gynec, if they are open to give our medicines, if they have the experience that we have good number of medicines to employ, you can work on these remedies. I have given it in few patients where colophyllum worked beautifully to bring on the labor pains which were very inefficient in that lady, and that caused a good delivery by the end of 8 to 10 hours of difficult labor. Then you read labor pains are short, irregular, spasmodic, tormenting, and useless pains in the beginning of labor like semicifuga. No progress is made. So the gynec will check and tell that the baby is stuck exactly at the same place where it was when the start of the labor pain started. It has not descended, the os is not dilated. That's what you read in the previous line, spasmodic rigid os. And in those cases, colophyllum will kind of open up things. It is a very good antispasmodic remedy. It is a very good relaxer for the uterus, and it will help in the ease of delivery. Colophyllum will correct deranged vitality and produce efficient pains if symptoms agree. So everywhere these conditions will apply if symptoms agree. Why? Because you need to see what are the presenting symptoms and what has happened in the past few hours which makes you think of colophyllum. If there is some causation which points towards something else, then go for that other medicine. Then we have hemorrhage after hasty labor, want of tonicity, passive after abortion. So, in cases where there has been incomplete abortion or there has been DNC done, but it was not clearly expelled, the fetus was not clearly expelled, or the abortion was abruptly done, or it was done in a rural setting where things were not good, and some things are still uh, you know troubling the lady, there is hemorrhage happening, you can think of colophyllum. Other remedies also very strongly work, which are sickle corn and Thlaspi bursa pasteuris. Then you have in colophyllum, after pains, after long lasting labors, spasmodic across lower abdomen, extend into groins in the shins, if it extend into the groins. If it is in the groins, limited to the groins, think of colophyllum. If it is extending to the legs, then think of carboveg and cocculus. So all these ladies who are with you in your treatment, they go into pregnancy, you should first explain them that there are many medicines throughout the pregnancy which you can give. If you read Herman's chronic disease, you will understand that uh, the constitutional remedies are best employed in pregnancy states because they cause the number one thing is that in pregnancy the constitutional state of the lady will flare up, and it will bring out symptoms which are the most troubling to her, like it can be thyroid, it can be blood pressure, it can be stress levels, it can be sleeplessness, it can be vomiting, it can be diarrhea. So you need to bring it down with indicated medicines and follow it up with constitutional. Second thing, when these females go into labor, we need to explain them that there are these medicines you can take by asking the gynec, or else you can give these medicines immediately as soon as the labor is done, whether it is cesarean, whether it is, of course, cesarean will require staph, will require arnica. It will also require colophyllum if there are pains which point towards these going from lower abdomen to the groins, or from the back to the groins. And this will kind of give them relief in the back pain or lower abdomen pain immediately that happens after the delivery, and it will save them from the pain for the next few months of it will save them from next few months of pain. Then we have lochia, which is protracted great atony, passive oozing for days from relaxed vessels. Sickle core is the other remedy. Colophyllum is similarly related to Cimicifuga, Belladonna, Lilium tigrinum, Pulsatilla, Sickle core, Thalaspi bursa pastoris, and Viburnum of opulus. And then we have Colophyllum, which is very similar to labor pains of Pulsatilla, but over there you will see that the mental condition is exactly opposite, where she is VP. Over here it is not mentioned, but you need to read other books to understand what will be the mind state of Colophyllum. It may mostly be opposite of Pulsatilla. Let's go and read Simicifuga. The remedy is mentioned in ACTEA, Actia resmosa, which is there in the A series. So, Actia resmosa, one of the top things that you should remember is that a female who is kind of a lady who is very snappish, who is very hard on herself. She has tried to commit suicide, injured herself, and she has also been someone uh, who has been feeling that some things are not good around me. I am always having bad luck going on with me, and then it will be with some CVS symptoms, cardiovascular system, or nervous related symptoms, or female related symptoms. So let's read. First line which is mentioned is puerperal mania, thinks she is going crazy, and compare the remedy syphilinum with it. Tries to injure herself. Mania following the disappearance of neuralgia. Now eliciting something which has happened few months ago, like we saw in abrotenum, like we saw in sulfur, like we see in other remedies, is very difficult. And I would suggest that if you want to elicit something that has happened in the past and then the other problem has started, try to be a good observer and put a chronology of symptoms on a paper when the patient is sharing the symptoms. Then you will be able to understand what was the expression of disease, what was the suppression, and what came later on. Patient comes to us with what came later on, and we are always ignoring what happened before the disease started. So it is very important, and if you understand this chronology, things are going to be very easier for you in your practice. Then you have something that is sensation, as if a black heavy cloud has settled all over her and enveloped her head so that there is all darkness and confusion. Now, this, if you go in many books and read, you will see that this is a symptom which is more likely to be of negative thoughts, thinking that everything is going bad around her. And it has been seen in the provings also, where the patients have reported, where the provers have reported that they have felt negative, bad, and something that is not good with them. So in this way, you will be able to classify if there had been a history of such symptoms and think of prescribing Simicifuga. Illusion of a mouse running under her chair, Lacan and Ethus are the other remedies. So even if there is not a real mouse, they will always feel it's an illusion. Of course, it's an illusion. It's not a real mouse, and also it will be something that is tormenting her and running around and troubling her, more like how the mind practitioners nowadays are analyzing, which is like something that is a small issue which is bothering and annoying her all the time. Ciliary neuralgia, aching or sharp darting shooting pains in the globes, extending to the temples, vertex, occiput, orbit, aggravated by going upstairs, better by lying down. Heart troubles from reflex symptoms of uterus, ovaries, heart's action, ceases suddenly or impending suffocation, palpitation from least motion. So many of the ladies and females would report to you with complaints of heart or heart issues or joint issues. You have to ask them what has happened with their female system in the past few months or years. If there is a sure shot indicator of some disturbance or some allopathic overdose or some allopathic intervention by surgery, you should think of these remedies, especially colophyllum, ecterismosa, and the other remedies which we will be covering gradually. The other remedy for CVH disturbance, similar to what we see in Cimic is digitalis. Then there is spasms, which is hysterical or epileptic, reflex from uterine disease and worse during menses, chorea, which aggravates on the left side. So, if there is a mention of the line where there is reflex from uterine disease, you need to understand that it is mainly something to do with a disease in the uterus which has been going on from many months. Either it has been treated or maltreated by allopathic medicines, and then it is causing disturbance on the psychological level. So, if that happens, semicifuga is the remedy to think about. Excessive muscular soreness, like you see in Arnica, after dancing, skating, or any violent muscular exertion, rheumatic pains in the muscles of the neck, back, and feels stiff, lame, contracted, spine sensitive from using arms in sewing, typing, piano playing, etc. etc. Like the remedies agaricus and ranunculus bulbosus. So those, most of the places you see that these DTP operators, the desktop printers, the desktop typists, they are employed. They can't move. They just have to type again and again in the same place. They need to be there. Think of simicifuga as the top remedy for them. Also think of ranunculus bulbosus. If it is lady, you should preferably give simicifuga. It is going to work beautifully for them. There is rheumatism affecting the bellies of the muscles, pains which are stitching and cramping. Menses are irregular and exhausting, like we saw in like we see in cocculus. Other remedies of alumina. They are delayed or suppressed by mental emotion from cold, from fever, with chorea, hysteria or mania, and increase of mental symptoms during menses. So you see this line which is mentioned, menses which are suppressed by mental emotion and some things which are physically affecting them, like from fever or from cold. Treating or handling patients with suppressed menses is a very big challenge. Number one thing we need to do is to find the cause. If you can find the cause, give the get the exact feeling which they felt, because it's an emotional disturbance actually, then you will be able to prescribe. If it is physical disturbance, like we read in Calicaria carb or pulsatilla or phosphorus or lactifluoritum, which is feet getting wet, suppress the menses, then, but you need to be sure that it is a physical disturbance which has happened. Then you can think of giving these remedies. And if it is from catching cold or if the throat pains have started, we saw the remedies in Visho aureus, we saw in the remedies yesterday, magnesiums, those or lag group also, we should think of those remedies when there is no cause and some physical symptoms have appeared. So I have prepared a very good document and PowerPoint on these specific things which we can give in certain cases like these of menses suppressed. And maybe after we finish the Allen study streak, I'll be posting somewhere on the timeline. Then in simicifuga, you have left-sided inframammary pains like the remedy ustillagomydes, and there are sharp, lancinating, electric-like pains in the various parts of the body, sympathetic with the ovarian or uterine irritation, and they dart from side to side, from one side to the other side. In pregnancy, we can think of simicifuga if there is nausea, if there is sleeplessness, if there are false labor pains, and sharp pains across the abdomen, and also abortion mostly at the third month, like the remedy Sabina. So the females who have come to you maybe with uh, complaints related to physical body, or they want to conceive, if we find a history of abortion at certain month, these remedies which are mentioned for certain months, like Sabina for third month, Simisifuga for third month, we should think of these remedies as intercurrents once the constitutional remedy is prescribed, because it's a trait which has not gone. And if the female patient is not conceiving even after giving constitutional medicine, you can give these remedies as intercurrent and then repeat it with constitutional medicine. It's going to benefit a lot. Then we have during labor shivers in first stage, convulsions from nervous excitement, rigid os, pains, severe spasmodic tedious aggravated by least noise. In the labor room, if they are affected with noise. Now again, this is an IPD setting which needs to be explored for these conditions. Rigid os needs to be examined by the gynec, or if you have a good gynecological experience, then you can definitely probe it. And if there are pains which are like colophyllum and McFus that you saw, you should think of simicifuga. And after pains again worse in the groins. When given during the last month of pregnancy, simicifuga shortens the labor if the symptoms correspond. And you should also think of colophyllum and pulsatilla in these cases. Rheumatic dysmenorrhea is the next symptom mentioned. So, where in which cases will you see rheumatic dysmenorrhea? You will see it when the patient is having menstrual pains, irregular menses, or there is with the irregular menses. Okay, with the irregular menses, there are joint pains, or after the irregular menses or lot of pains, she has rheumatic complaint before or after, or it goes along with it. So something which has this combination, you should think of actia responsa. Modalities, you see it is worse during menstruation, more profuse the flow, more greater the suffering. And you see that it is similar to colophyllum and pulsatilla. In uterine and rheumatic affections, it is similar to agaricus, lilium tigrinum, and sepia. So the next remedy which we come to, lilium tigrinum, one of the most under prescribed remedies. And if you have cases of pelvic inflammatory disease, this remedy is going to work like a miracle. Let's read what is there. Tormented about her salvation, lycopodium, sulfur, and veratum are the other remedies mentioned. With ovarian or uterine complaints, consolation aggravates. Wild, crazy feeling on the vertex, confused ideas, profound depression of the spirits, can hardly avoid weeping. Is very timid, fearful, and weeps much, indifferent about what is done for her. So, this is a state of mind which has developed after many, many months of not having a perfect family, or not having someone perfect to look after her. And if this is expressed by patient or her relatives, then you have a chance for giving lilium tichinum. Not only that, there is lot of anxiety about the disease and she cannot stay alone. So you will see that in further lines, anxious about the disease, fears The symptoms indicate an organic affections marked in both the sexes. So you can think of this remedy in females as well as males. Disposed to curse, strike, to think obscene things, and it alternates with uterine affections. Now, getting to this symptom requires more privacy and more confidentiality. So maybe you will need to think about ways about how you will explore this symptom from the patients in the clinic. Listless yet cannot sit still, restless yet does not want to walk. So you see that there is this tug of war. Okay. And if I were to describe Lilium tigrinum as a remedy to prescribe, I would just list three words, which is tug of war throughout the mind and throughout the body. If she wants to do something, okay, if she wants to do something, she will do in a hurried manner. And if she wants to sit, she can't sit, she just restless. So aimless, hurried motion, desire to do something in a hurried manner, yet has no ambition. Like the remedy urgentum metricum. Fears being alone, insanity of heart disease, fear she is incurable, some impending calamity or disease. Affects principally the left side of the body, like the remedies lachesis and thuja. Cannot walk on uneven ground. Now, this is a very, very, very tricky symptom, and I would say that we can discuss more about this when we take up this remedy individually and study it in comparison with the other remedies later on. There is pain in small spots which is constantly shifting, like the remedy Calibicromicum. Sensation as if heart was grasped in a vice, like the remedy Cactus, as if blood had all gone to the heart, feels full to bursting and inability to walk erect. Now, this is a very strong physical symptom. If you have patients who have IHD or heart related complaints, you can get access to this symptom by asking them more narrowly about their feelings about the local organ. Then we have pulsations over the whole body and full distended feeling as if the blood would burst through the vessel. The other remedy being Aeschylus. Now, about this, if we read in Aeschylus, we will not find, but instead in Aeschylus, we will see everywhere that there is a total congestion, and it's a remedy which is more suited to venous congestions and venous affections. And over here you see that there is more of indication for Lilium tigrinum and Aeschylus for something related to the blood vessels and the feeling that something is full and it would burst. There is palpitation, fluttering, faint, hurried, anxious sensation about the heart, apex of the heart, sharp pain in the chest, awakens at night, irregular pulse, extremities cold and covered with cold sweat, aggravated after eating, lying on either side. If it is lying on the left side, it is lachesis. If it is aggravated on by lying on either side, think of Lilium tigrinum. And then there is a mention of rapid heartbeat, which is 150 to 170 per minute. Now, how will you get access to this symptom when you are in your clinic? You will examine the patient. Everything in the case so far was perfectly expressed. There was nothing which you could think of makes you think of Lilium tigrinum. And there are some complaints of the physical body for the female system, for heart, etc., etc. When you examine the patient, you will see that there is a cold clammy perspiration, and you will see the heart rate, or you will see the pulse rate, it will be little bit accelerated. And if you get a chance to observe it correctly, in some cases you will notice that it's irregular. Sometimes it's fast, sometimes it's slow. From this you can develop an entry point into Lilium tigrinum, and then you can ask the patient whether her activities are done in a hurried manner, whether she has those sensations which we read in the previous page, whether she has the feelings that no one is doing anything for her and she feels bad that no one is there to care for her, etc., etc. And maybe the case may open up in this way, or it will lead you to something else. So in this way, from the physical aspect, you will be able to lead yourself into the mind of the patient. It is not always that you will get something which is very peculiar in the mind, but from the physicals you will be able to probe something about the mind which is particular about the remedy, and then you will be able to finalize whether you need to give this by confirming or giving leading questions to the patients. In the gastrointestinal system, for Lilium tigrinum, we have constant desire to defecate and urinate with prolapsus from pressure in the rectum. Frequent urging to urinate if desire is not attended to, there is sensation of congestion in the chest. So, this frequent urging to urinate, we saw in a few remedies in the last 25, 26 days. Your homework is to go back and tell about the remedies that are there in frequent urging to urinate, and how will you tell these remedies to me. One thing is that you can comment on this video. Second thing is, if you are not a part of my community, WhatsApp community, where we engage in discussions and put on some questions for the participants, and very soon we'll be posting some cases as well, you should drop a message to help you join the community, and we'll get back to you to join this WhatsApp community. So your homework is to find out what remedies have been mentioned for frequent urging to urinate in the last 26 days. Then in Lilium tigrinum we have something which is headache and mental ailments depending upon uterine irritation or displacements, menstrual irregularities and irritable heart, bearing down sensation in the abdomen and pelvis as though all organs would escape, like the remedies Laccan, Murex, and Sepia. And they feel better by touching the hand on the private organs, and they will feel that there is a lot of heartbeats or tachycardia which is going on. Many times patients would sit cross-legged. This is just to prevent the sensation of bearing down or heaviness extending to that part. You should think of Lilium tigrinum in those cases. How patients sit will also guide you to the medicines. For example, just 2 days back, I had a lady who was a girl, rather, who was sitting like a, you know, like a male boy. And how would you recognize that? Usually females sit with legs exactly on top of each other, but this lady was sitting like an L shape, or she was making a square of her legs when she was sitting, not on the ground but on the chair. And this is mostly like how the men sit. That is what leads you to confirming the remedy, and then you ask a few questions and confirm the remedy. So, Dr. Cheryl, you have answered like podium for frequent desire to urinate. I'll also have to find out, maybe uh, it's right or wrong. So, we'll find it out. Maybe you can drop the answer in the community. I think you are a part of it. And it from my memory, from so many times that I've read, it is not like podium, it is the other remedy, but we can definitely go over this remedy as well. So I was at this point where how will you recognize patients' remedy from their posture, and there are these nitty gritty things which you need to recognize. Their way of sitting, either they are relaxed, either they are too active, either they are bent forward, or they are standing, they are too close to you. All these small things will make you think of the remedies, different remedies for different behaviors of patients. Further down the line in William tigrinum in Allen's keynotes, you have menses, which is early, scanty, dark, offensive, flow only when moving about, and it ceases to flow when she ceases to walk. Similar presentation we see in causticum, and if it is more If it ceases to flow when she lies down, the remedy is macabre or creosote. Weak anatomic condition of the ovaries, uterus, and pelvic tissues, resulting in anteversion, retroversion, or subinvolution. All the patients who land up to your place with sonography reports which show retroversion, anteversion, subinvolution, you should think of Lilium tigrinum. And there is there are other two remedies mentioned, Helonias and Sepia. And there is slow recovery after labor, nearly always with constipation from inactivity of the bowels. So there is a weak and atonic condition of the uterus which is mentioned, and this means that there is a sluggishness, stagnancy. And I started this remedy by telling you that it is one of the top remedies for PID, pelvic inflammatory disease. And these are most of the symptoms that you will have in many of the females. Some pains in the lower abdomen, some disturbances, and it will be more of a dull kind of pain, and that is actually the tonicity of the muscles and the ligaments in the pelvic region. You should think of Lilium tigrinum. Second thing is that many of the females have a repression of their sexual desires, and that is what would make you think mostly about Lilium tigrinum first, then about the other remedies, which also may cause a lot of problems. So these are the few things, and then you will see the mind symptoms and something which she does in a hurried activity, and a weight feeling on her vertex, which you will find mentioned in the other books as well, where there is hyperactivity of the child, of the lady, because someone in the home is doing something, her child is not behaving well, her husband is not well behaving well, or there will be kind of a compensation which she does by doing her hyperactivity. So we have this weakness or tonicity of uterus and different presentations of uterus, and how will you prescribe for PID. Lilium tigrinum can be compared with Simicifuga, Agaricus, Cactus, Helonias, Murex, Natrum fos, Platina, Sepia, Spigelia, and Tarantula. There are a whole long list of remedies, and maybe if we get a chance, we'll cover it in this week or maybe next week, because we are connecting the different remedies which are related to this remedy, and helping reach and the understanding of these remedies from Alan's keynotes. So that's it from me today. And Dr. Cheryl, you have answered about cantharis and sulfur for frequent desire to urinate. So let's see. Let's get more answers, and we will also answer very soon in the community. So those who wish to join the community can drop in a WhatsApp. Can drop in uh, your willingness to join, and we will send you the link of WhatsApp or the contact number where you can drop in a message and you can join the community. So that's all from me right now, and see you all tomorrow. Tomorrow being Sunday, we will maybe do the session a bit early and try to cover maximum number of remedies. And uh, yes, so we'll see tomorrow. So Dr. Amena, you can drop us a direct message in the Instagram, and we will add it, send you the link.